everyone. My name is Katie Brumfield, and I am the Colorado School of Public Health Career Services Specialist. And today I'm talking with Johnny Williams. Johnny graduated from our school in 2019 with a concentration in health systems management and policy. Hi, Johnny.
Right. Hi, good morning.
Good morning. Happy Wednesday.
Yes,
Um,
happy Wednesday.
I was like, wait, what day is it? So thank you for joining us today for our Coffee and Careers. These are short chats about your career path. Can you tell us what your current job title is and a little bit about how you got there, your career path, what led you to public health?
Yeah, so my current title is a study manager slash senior PRA, so like a dual role. And it's for this obesity project. So essentially, we are finding a way to implement a tool in Epic to help providers treat obesity, because typically obesity is not treated in a primary care setting. So we're working together as a team to find a way to actually support the doctors so we can address obesity.
That's great. And where do you work?
I work at the Department of Family Medicine on campus.
At CU Anschutz? Okay,
Yes.
great. And what led you to public health? Like, how did you decide to get a degree in public health?
Yeah, so my public health journey is probably a lot like everybody else's. I grew up wanting to help people, like, hey, how can I help people? So my whole life, I was like, yeah, I'm going to be an MD. I'll be an emergency medicine physician. I'll wear the scrubs and it'll be so nice. I'll be a doctor. So after just living life and experience things, and just, I'm from Oklahoma. So just living in Oklahoma, going to Oklahoma State University, I had the opportunity to do an internship in public health called the Future Public Health Leaders Program. And I was based in Ann Arbor, Michigan. So going up there in the summer of 2016, I believe, gave me the opportunity to see that there were other fields of medicine besides public, or other fields of medicine, including like public health. So I was able to go up there, I was able to deliver water in Flint, I was able to do environmental audits and just help lead community programs against substance abuse. And it showed me that like, oh, hey, with public health, you don't necessarily have to be a medical physician to actually help people. So I shifted gears and I was like, hey, I'm no longer pre-med, I'm pre-public health now. So it was nice just not needing to take any more organic chemistry and just getting to actually focus on like more of the sociology and work like my writing skills. So I could actually apply to the School of Public Health. And luckily I got in, and a couple of years later, here we are.
And how did you decide in health systems management and policy concentration?
Yeah, it came from actually working in Flint, hearing and then getting to go to the CDC and hearing them say, like, hey, we can't necessarily do anything about the water crisis right now because the CDC can only do things that are mandated that the states ask them to do. So they actually have to be invited in to do something. So I was like, hey, that's a policy hole. It shouldn't be like that. Like, if a town doesn't have water, it shouldn't have to be all this red tape you have to cut through just to make sure that people have clean drinking water. So just seeing the policy side of things actually just made me wanted to, hey, maybe we should work on public health and policy. So yeah, we can make people healthier and then create laws to make sure that this doesn't happen again.
Yeah, no, that's great. That experience sounds really life-changing.
It was.
When you were a student at the Colorado School of Public Health, what courses really helped you prepare for your current role?
Yeah, I can think of probably three right now. The first one was it was interpreting research or something like that. It was taught by Dr. Angela Sawaya, and that class single-handedly taught me just how to tear apart a research paper, because this you have to be critical of the things that we read, because it's so important to make sure that you understand what you read. So that was definitely the first class. It gave me the strong science foundation to feel have the confidence to actually read these papers. The second one was a health policy class I took with Dr. Greg Tung. And it just showed me like, oh, wow, you can literally use the law to justify why we need to have healthcare. And that by far was amazing. And then finally, the last class I took was qualitative research methods with Dr. Visconti. And that class just tied everything together and just truly showed me like, oh, hey, I actually do have a career in qualitative research, which is just doing interviews and things like that to get the why behind it. So definitely those three classes were the most influential I took.
That's awesome. Could you describe what a typical day in your role looks like, or if there's like long-term projects you're working on, but what do you do?
Yeah, so a typical day is great because the good thing about public health is nothing is typical. You're trained to do so many different things that you never get bored. So there are some days you start at 7 a.m., you're checking emails, you might have a meeting with the clinic. And then some days you work till 6 because you have another interview with like somebody from the clinic, because you have to work with the doctors. So it's a lot of emails, it's a lot of communicating, it's a lot of putting out little bitty fires that we're working virtually. So sometimes there are lapses of communication. I send out the incentives to people when they do their interviews, and I do the interviews, which is great. It's great talking to people and just hearing their story. We analyze the data. So it's pretty much, I pretty much do a little bit of everything. And then I work closely with my PI to make sure that I'm doing everything correctly, of course. And then it's up to their standards. And that's pretty much it. So it's very just recruiting, following up, a lot of communication, making sure people get their money when they're supposed to get their money. And then that's pretty much a typical day.
Kind of project management
Yeah,
of
yeah, more of managing. Yeah, it just depends. This switches from management to data collection. You never know which day it's going to be.
yeah. What would you say? How long have you been in this role?
I just got promoted to this role. So I started in January doing
Oh,
this. So before I was on campus at Accords, right fresh out of school. So that was a job you helped me to get. I appreciate that. Career services is great. So being Accords, it taught me how to develop my research skills. So I was a qualitative research assistant. So that's all I did was just interviews and surveys, interviews, surveys, and I got really good at it. And luckily, I was able to take those skills and mix them with the other skills I gained in my master's to actually become a study manager, which is great.
oh, that's so great.
Yes.
Because I was going to ask, what are you most proud of in this role? But I guess since January, it's not a ton. But overall, I guess, what are you most proud of in your career?
Yeah, I could say overall was I would say because I'm trying to fit this into words. I'm able to like almost mix two worlds. So I'm able to work in academia as well as the community. So the little logo I have behind me is the Colorado Black Health Collaborative. So I'm able to like spend like my other free time working with them. So we're able to do right now, since the pandemic, I'm a health educator. So in my free time, I'm able to actually help educate the Black community about just COVID things in general, help get people connected to resources. And then in the daytime, it's like, oh, I'm a superhero. I get to go back to the university and actually get it right from the source. So I'm able to hear the best information that's coming from the smartest scientists that we have in the state of Colorado. And I'm able to actually take that information to the community, which is like great. So there's actually a linkage between academia and the community.
That's amazing. How do you juggle your time?
Oh, a lot of coffee. And luckily everybody's really flexible. So there are some days, you work at 7 till 3 and then, hey, you have a couple of calls to make from like 5 to 8. So
Yeah.
it's not like that every day, but it's just the good thing about public health and being virtual, everything is so flexible. So you can always make your career work for you.
Now, when you started the program, did you think you would take a job like this? Because a lot of times I hear students say, or alumni say, I never thought I'd work in blank, but I really enjoy it. Could you talk?
For sure. Yes. I thought it was going to be like a health policy, like research analyst. I was like, yeah, I'm going to go to the Capitol. I'm going to work with my representatives and we're going to fight for public health. But then I realized, hey, this is really hard to get into without experience. So I should get some experience first. So I just brushed up my research skills. So luckily I was like, hey, being a research assistant is a great way to brush up your research skills and get on the job training for the career that you might want to have in the future. But then I started to fall in love with research and I'm like, oh, this is great. This is great. I love talking to people. So now I'm so happy doing research that eventually I would love to probably take some of the research and send them to the politicians and Congress people just to, keep the policy side going. But I love research now. So
That's
that's my baby.
I love hearing that because I know a lot of times in public health, there's so many cool things you can
Mhm.
do, and it's hard to narrow down. And I love hearing these stories of kind of falling into a career in public health
Mhm.
that you really enjoy that you never knew you might enjoy.
Yes, I would agree.
Were you involved in any extracurricular activities that helped prepare you for your career while you were a student?
Yeah, I was part of CPHA as a student, the Colorado Public Health Association. And then also, too, one of the first things I did, which kind of really pushed me into public health, was doing a case competition that was offered at the school. So luckily, we got third place, which was great. It was so much fun. We were able to we had 24 hours to come up with a public health solution. And it was completely interdisciplinary. And it showed me like, oh, hey, I can work with like a medical student and like a social work student and I'm a public health student and we're able to just mix just all the things that we know to actually come up with a solution. So it showed me like, oh, hey, this is what I want to do for sure.
Yeah, I love that competition. We weren't able to have it last year because of COVID, but I hope it picks back up because
I
it's
do
really
too.
fun.
It is.
What advice would you give to someone that might be viewing this video that's thinking about a degree in public health, but they're not quite sure?
Yeah, I would tell them, don't focus so much on what you want to do, but more so on who you want to be. So when you walk into the room in public health, it's what do you want people to associate you with? Like, so for me, my passion is obesity prevention. So it's like when people see me, it's not so much, oh, hey, you're a study manager, but it's like, hey, I know you work with the community. I know that you're passionate about these topics. So I would definitely say find what you're passionate about, and the job would definitely come.
I love that. That's so cool. All right. Well, Johnny, thank you so much for spending a little bit of your time today with us. And thank you for all the amazing public health work you're doing. I can't wait to see how your career evolves.
Yeah. Well, thank you so much for the opportunity. I'm excited to help others in the future. So I'm always here.
All right. Thank you.
Mhm.